our stakeholders recognise that with our help they can develop systems which are going to facilitate and optimise the care that people can in fact take for themselves in the communities.
A year ago, the West Midlands Academic Health Science Network formally launched its membership system. We have two types of membership. We have our AHSN membership, which is essentially funded by NHS England and NHS Improvement. And that is used to secure the membership for all of the West Midlands-based health and life science industries, for the academic and educational institutions in the region, and for the NHS and the local authority providers and commissioners. So they're all members of the Academic Health Science Network. And through that membership, they get access to our networks, to our Meridian Online Health Innovation Exchange, and we connect them together to bring beneficial innovation into play for the benefit of the care sector, but also to have economic benefits both for the health and life science industries, but for the individuals in the region whose health and well-being is improved.
What we're trying to do is exemplify that by bringing together a network and almost a ecosystem for innovation to thrive shows how you create health and benefit the wealth agenda too. So it's about demonstrating that we're open for business. We always talk about UK PLC, and in the light of Brexit, how do we identify areas where the UK is great at delivering on the adoption of innovation. So it benefits us not only as a region, but then as we reach out to other academic health science networks across England, as there's 15 of us in total, so it's about reaching out to those different networks.
The way we work with West Midlands AHSN is that we always try and keep them informed of the innovations that we pick up from members of staff from within the organisation, and discuss with them the different ways that the AHSN can potentially support us with further progressing of those ideas. And it could be anything from protecting the IP of a particular idea or a solution or a device, all the way to finding external resources who could help us.
So what's unique about the way that we've approached this within the West Midlands is we actually have 3 ambassadors who are working on the 100,000 Genomes project. No other region seems to have gone down that route. We're able to look beyond just the recruiting. We're looking at the transformational elements of the project as a whole.
The AHSN has been very helpful to us. We are on the Meridian programme, which has opened a lot of doors and contacts.
I think it's more about the ability to create a network, to promote and organise conferences, and to actually just basically get to individuals in the West Midlands who we think would be very interested in some of the processes, some of the innovations that we're trying to move forward in safely.
So about 2.5 years ago, I had an idea to start learning from excellence. We created it in our hospital and launched it in our department in intensive care. It rapidly spread within intensive care and then outside the walls of intensive care within the hospital. Then the AHSN got involved and helped us scale it up. We've done that through a series of workshops within the region, and now we've started delivering appreciative inquiry training within the region as well.
Working with the AHSN has been brilliant. They have provided us with funding in the first instance to test bed the BVI tool with real people in real time in a really safe environment to give an independent response to the consumer research organisation that we're working with.
As you might imagine, there's been clinicians that have needed extra training to deliver this type of intervention, and the AHSN have been absolutely superb in helping us ensure that physios across the West Midlands have been trained to deliver this. So we've trained over about 200 physios now across the West Midlands patch to enable them to deliver this intervention, so patients are getting the right treatment. Now, with the help of the AHSN, we've now managed to get our approach endorsed by the NICE, so it's in nice guidance, so that will give it a more sort of public profile as well as with the AHSN.
I've helped to get a focus on patient-centred care last year, and then that's become evolving into the long-term condition network that I lead. And because it's about adoption, dissemination of proven innovation, the AHSN mantra, then I particularly focused on technology-enabled care services and how you can use those to improve the delivery of care for people with long-term conditions.
And what we've done as an academic health science network is established partnerships between organisations that have RAID and organisations that don't, to help those that want to set up a good psychiatric liaison service to learn from the best and really hit the ground running with an excellent service. And as part of that, we established a regional RAID network, which originally we intended to have about 20 people from across the region. Now it's 3 figures. We're getting over 100 people attending from across the United Kingdom and even internationally now. So it's now the national RAID network that we established, and we're really proud of that.
If we are going to deliver core economic benefit, that has to be for the benefit of patients, it has to be for the benefit of industry, and it has to be for the benefit of the NHS. We are driven by the need to deliver healthcare sustainably at a lower cost, but for better outcomes for our patients. And working with industry, looking at innovation and new models of care is the only way that we're going to deliver that.
The West Midlands Academic Health Science Network have been instrumental in us getting access to finance. In May 2016, we received £50,000 from Creative England. Following that, in September 2016, we were fortunate enough to receive the SME Innovation Fund, a collaboration between West Midlands Academic Health Science Network and Mercia Technologies, which actually also came with one of our largest potential markets in NHS staff wellbeing. And then in November 2016, we were fortunate enough to win the EIT Health Award, which was €50,000, but importantly for us, partnership and support from the likes of IBM, Pfizer and Procter & Gamble, which can help us to accelerate into European markets over coming years.
In the Serendip Incubator, we work with businesses in lots of different ways. I mean, the first thing I would say is our support is very tailored, but there are probably a number of things that all of the businesses require.
So in terms of the adoption, that's been the challenge. We've got effectively networks around the country, but at the end of the day, the trusts operate autonomously. So the sales piece and the adoption piece has been the hardest bit. Like I said, having the idea is the easiest bit, but the AHSNs have supported us that and have introduced the right contacts where we can.
By having access through West Midlands AHSN, that gave us access to that funding stream. It's a competitive and peer-reviewed funding stream, so you don't just get through to it anyway, so you have to go and compete with everybody else. But it is entirely because of the West Midlands that we were in that competition at all.
I need to pay enormous respect, gratitude to the teams who work together. Our leadership has been exemplary, and the people involved in all these projects. So when I say that, in a sense, one of the biggest challenges is to make sure that our outstanding team stay together and that we can enthuse them and motivate them related to the work that they do.